And I'm being joined with Dr. Andrew Lee. He's the medical director of the Texas Center for Proton Therapy. Thank you for having me out here at your beautiful facility.
Oh, my pleasure. Thanks for having me.
All right, let's dive right into it. What is proton therapy?
Proton therapy is a unique form of radiation therapy to treat patients with cancer. It's unique in that it uses subatomic particles called protons, accelerated to very high speeds to precisely target and treat tumors. The one main advantage it has over conventional X-ray therapy is that we can minimize the exposure on the way in and have almost no radiation exposure on the way out. Thereby we can increase the dose of the tumor and increase tumor control, but also decrease dose to normal tissue, and therefore the patients can have fewer side effects both early and down the road.
How's it delivered?
So typically protons are accelerated using an accelerator. We use something called a cyclotron that will take a proton, which if you remember from high school chemistry class is just a hydrogen atom with the electron taken off. And that is accelerated like a bullet, and it is accelerated to about 2/3 the speed of light and then sent down a beam line that's controlled by high-strength electromagnets. The patient is lying on a table that can be oriented in any number of positions inside something called a gantry. And these gantries are huge machines. They're about 30 feet wide, weigh over 100 tons. And that's what orients the beam at different angles. So if we need to treat a patient from the front, we can do that. If we need to treat from the side or at an angle or from the back, we can also do that.
Now, what types of cancer are you treating here at the Texas Center for Proton Therapy?
So we've treated a wide variety of cancers. Some of the pertinent cancers include tumors of the brain and spine, but also of the head and neck, of the chest, such as lung cancer, and also of the abdomen, such as liver cancer and pancreas cancer. It's also good for treating tumors in the pelvis, such as prostate cancer. And of course, we've treated a lot of children with cancer. As you may know, since the bodies of children are still growing, they tend to be very sensitive to even low doses of radiation. So minimizing exposure in those kids is very important.
This is a great option for them. And Dr. Lee, I'm sure you know, but if in case you don't know, September is Prostate Cancer Awareness Month. Why is proton therapy a good option for those who are treating that?
Well, for appropriately selected patients with prostate cancer, one of the things is it tends to have a very high cure fraction, but the patients also want to preserve their quality of life. Proton therapy has a good track record for having a very high cure rate and having a relatively low side effect profile. It's performed on an outpatient basis and it's non-invasive, and it's been shown in many studies to be very effective.
Now, I'm sure proton therapy has really come a long way. How would you say that it's evolved over time?
Absolutely. I would say over the last 10 years we've seen some incredible advances. One major advance is the utilization of something called pencil beam proton therapy. And what that basically is instead of shooting protons like a big spray, like a can of spray paint, it's more eloquent. So it's like shooting protons one spot at a time, like using an airbrush.
It's more direct.
Exactly. And so what that can do is cover the three-dimensional shape of a tumor more accurately. So it's almost like three-dimensional needlepoint that can be delivered very quickly.
Thank you for having me out.
My pleasure. Thank you.
The Texas Center for Proton Therapy is off of Royal Lane in Irving. You can give them a call at 469-513-5500 or go to texascenterforprotontherapy.com.